Today, on a special edition of Behind the Blue, we are joined by Dr. Eric N. Munday, UK's Executive Vice President for Finance and Administration. Thank you so much for being with us.
Great to be here.
Among many duties, Dr. Munday has helped lead the crisis response of the university to COVID-19, and it's something that you have a great deal of experience in, having helped lead responses to two major hurricanes while serving in senior positions at Louisiana State University. That crisis response is something we'll want to visit with you about at a later date, but this week, this episode, we are also discussing what will be a very challenging budget coming up this year, created not only from the coronavirus, but the additional blows to the economy. Along with Dr. Capilouto and other senior leaders, Dr. Munday leads a team that is developing a proposed budget for 2020 and 2021. And the idea, President Capilouto said in an email to campus last week, is to make the, quote, painful and tough choices that will position UK to thrive when we emerge from the crisis. And Dr. Munday is joining us to discuss that process and the steps that UK is taking from here. So first thing, UK's budget, how is that put together in normal times? And what are the things that you think about as far as this, how that comes together and the size and scope of the organization?
Sure, Cody. When you think about the University of Kentucky, we are enterprise. So it's $4.5 billion budget for the university, and that's in fiscal year 20, the year that ends June 30th. In a few months here, and that includes all the components. So UK healthcare is roughly about 50% of that. You have the auxiliaries like athletics, that's around 150 million of that 4.5 billion, and on and on and on. The component that has the most ability to for us to work on is that undesignated general fund. And when we talk about that base budget, let's call it 850 million of that 4.5 billion. What we're really looking at that point is what we're receiving from the state and state funds, and also what we're generating in tuition and fees. And then there's a few other sums of monies that come together, but that's that base. So generally what we do is step one. And when we build that budget each year, we're assessing what resources we have. And so what do we look at? What the resources, what are the needs that we have? So we're really looking at, wants and needs. We're understanding where we are, what's the state going to provide, what we see as enrollment, and we're starting to understand if there's a gap. You've heard me say this term DSI maybe before. It stands for direct student impact. Once we look at what we need to do, what we're going to bring in revenues, what's that gap? And what we want to do is we want to see available funds that's extra that we can then reinvest in the enterprise. We can push to the colleges based on productivity, based on higher enrollments, based on teacher quality. Sometimes, though, unfortunately, that gap is negative. There's not enough to fund the required needs of the enterprise, required needs of the budget. And then the last step in a normal year is we then look at tuition and fees. We don't start there. We end there. And then we try to balance how much we're going to have to go up in tuition and fees. And then that helps close that gap ideally. We reinvest and we continue to grow as an enterprise and serving all those missions, though. So when you think about that 4.5 billion, it's teaching, it's research, it's our service mission, it's our healthcare mission. And that's how we normally do it on a regular year.
So facing our situation now, dealing with COVID-19, how has that impacted the budget? Can you quantify or describe that? How does that break down?
Sure. I mean, it's just such a significant pressure because it was so quick. I mean, you don't know, and you look back and you're trying to say, oh my goodness, like day one, we were here, we were figuring out, a way in which we could change the modality of delivery. And then a week later, our employees were having to go and change their modality of work and having to go home and couldn't be at the workforce. And so you had so many things moving so rapidly. And I think the context of COVID-19 is, and it continues to be, The unknowns are greater than the knowns. So Cody, you referenced there's about 7 different crises I've been involved in my career. I don't know if that's good or bad, but there's about 7 different ones, hurricanes, tornadoes, ice storms, student protests, so on and so on. On almost all of those, we could put some frame around when we return to normal operations. And that just helps so much when we know that frame. On this one, we don't know. That's where our eye is. And so when you think about your question, that budget impact, the pressure is through, it's disrupted our students. It's disrupted our ability to manage institutional operations. It's clearly disrupted our finances, and it's disrupted our finances in almost every single source of revenues we have. UK healthcare, our research enterprise. We had to refund housing and dining, rightfully so. About 36% of the time, our students weren't here. So we gave them refunds of housing and dining refunds or credits that we ended up. We ceased elective surgeries in UK healthcare, which was the right thing to do. That was the thing that we were asked to do, and it was the right thing to do for our people, for our community, for our healthcare providers. But you can just imagine what kind of impact. We get to the 9 digits, so greater than $100 million of impact within just a few weeks. And so I think that's one component. And then Cody and I on fiscal year 21 and how you open this discussion. When we think about next fiscal year, well, are we back in operations on July 1st, August 1st, September 1st? We have to plan for all of those different contingencies, but we don't clearly know when we're going to be back to normal. As the president said, and it's one of our principles that's so critical, our goal is to thrive as we emerge, but we have to keep our eye on, a safe and normal operations as soon as possible. So that's a little bit of the challenge from a budgetary standpoint we find ourselves in.
Yeah, we are joined by as well by Jay Blanton, UK's Chief Communications Officer, and Jay and I have taken part through UK Public Relations with a lot of crisis training exercises, tabletop exercises, where we go through a situation and we talk through that situation and how we would handle that. I'm sure you've done countless of those. This seems like such as much as you prep and plan, and I think we've met this along the way and met the challenge every step of the way, but it seems like such a strange kind of thing comparatively, because other things that you plan for impact facilities or impact things that you might look at that impact a financial sense, never taking into account something that impacts personnel and students and the human side of that, where not only do you have that impact on the facilities and economic side, but also on, like, it's an empty campus right now. That seems so strange.
Yeah, I think it is unusual. We scale our response based on the crises. And so we have 19 different work streams through the Emergency Operations Center, through the EOC, that are helping to manage that. Normally, in my experience, we would have 3 or 5 or 7, but it speaks to exactly your point, Cody. It impacts all the enterprise. So whether it's the academic delivery, so now we're talking about, and we made the decision that summer is going to remain online, and that's going to be, so what did we have to think? We had to change our pricing strategy, because it's one thing to look at something for a few weeks in a semester. It's a whole nother thing to look at in the course of entire summer period that can go as long as 12 weeks. We're not going to have students living on campus this summer. How does that impact our student services? How do they stand up and they're utilizing Zoom like we are and other things to communicate and to build those interactions with students? How do we advise students differently? Cody, your point's so right. The students' lives are so adjusted because they can't move. We have no free movement. So our movement in and of itself is adjusted because we're adhering to social distancing. We're trying to do what we're being asked to do because it's helping us all. But I think the thing I hear most from our students, and we participated in this call exercise where our student and academic life have taken the lead of calling all of our students, all 31,000 of those students. What we're hearing so much just even early is, I need a little more structure around my day. The day. So I teach a class, and I'm so impressed at the participation. I do it via Zoom when it was normally scheduled at 1:00 on a Monday and Wednesday, just finished a little while ago. And it's amazing, but you have like 2/3, 3/4 of the students logging in right there at that time. I record it, post it, but they can watch it later, but they want that interaction. And it reinforces we're the residential experience. That's what we're best at. That's what we want it to be. We believe that's special, that's distinctive. And I can't wait to get back. I know our students can't wait to get back as well.
Let's talk through the sort of the brass tacks of what we're facing. So talk to us a bit about, quantify for us the short-term, medium-term kind of challenge of this budget, and then speak to what are the steps we're going to take to address it and how we're doing that.
Sure, Jay. So let's put it in two buckets as our challenge. We have about $40 million. And so I'm talking about the $850 million, that base budget, Jay, of that $4.5 billion. So UK healthcare, we have challenges in that. Athletics, we may have challenges in that budget, right? When we get to research, we may not be able to continue to perform certain research for a period of time. We could have challenges of that budget, but I'm narrowing that $4.5 billion down to what we call the base budget, that undesignated general fund. So when you look at that, two components of large summary challenge, about $40 million of reduction and about $40 million in revenues from enrollment. So let's call it tuition and fees. So we thought it was going to be X. It's going to come in $40 million less than X. And investment income. We know what the market has done. We're talking about where we take our available cash and we invest that in, just like we do a savings account personally, or maybe a certificate of deposit or some type of short-term instrument to generate some additional interest revenue to help fund the enterprise. Well, impact between those two things, $40 million. Plus, just to keep the lights on, just to start again on July 1st, if you think about it's $850 million, what's it, 2-3%? Just to regular, what do we want to call it, inflation, or just keeping the light, utilities going up. Additional scholarships for our students, right? We're reinvesting in funds that our students do not have to pay back based on need as well as merit. And we want our colleges to be more productive, right? We want them to be focused on productivity indicators. So we're investing in that, whether it's utilities for buildings that we've opened and so on. So you have about $40 million in revenues we're not going to receive that we thought we would. And you have about $30 million in increased costs based on strategic investments that I've spoken about, based on quote unquote keeping the lights on, if you will, and so on. So it's a $70 million problem. That's the challenge we have. And when you think about a $70 million challenge on an $800 or $850 million book of business, you quickly in your mind say, holy mackerel, right? I mean, we could be 8, 9, 10, 11, 12% of challenge that we got to think about as we look to solve this budget for fiscal year 21.
So talk to us now about what are some of the steps that we are going to take, and the president's taking, and consultation obviously with our board of trustees to address the shortfall.
So we start with 70 and we look at a contingency fund. So eye on the ball, right? When we're thinking about fiscal year 22, not just getting through fiscal year 21, how do we ensure that we're not having regular conversations about reductions? So we're going to do a little bit more. We're going to cut a little bit more. We're going to reduce ourselves a little bit more than we need to solve that 70. And we're going to build in a contingency of about 15%. So let's call that $10 million. So we have constructed a reduction scenario, reduction plan that we're rolling out. that looks at each one of those areas that report to the president, right? The president's office and the areas that he works with directly, the provost area, the research area, the EVPFA area, the area that I lead. And we're assessing each one of those areas a 10% reduction. So all of us, if our budget was $1 million, we're going to be assigned $100,000 reduction in that example. So once we're assigned that reduction, then each one of those leads, let's talk about the provost then looks at that reduction and he will allocate that reduction across the colleges based on some differentiated basis. We do not do across the board cuts at the University of Kentucky. We're going to do some type of differential cuts across the enterprise informed by data. The provost is using what's called the college productivity model. It's a model we've worked on for maybe as much as a year now that looks at various productivity indicators, research productivity, teaching productivity, and so on, that is informing those reductions. And then those will then be assessed to those college on an individual by individual basis. If we think about the EVPFA area, what we're looking is cuts ranging from 7.5% to 15%. And we're working to understand what that means. And then we'll work, we could cut some units 0% if they're very small and there's really nothing that's cuttable, if you will. That means that we have to cut other areas greater than that, but it'll be based on performance. It'll be based on what we're trying to achieve. It'll be based on outcomes, but we're going to have a differential cut. So that's, I guess in some ways, Jay, that's kind of step one on how we solve the problem. Step two, unfortunately, is we have to go beyond that. That's not enough. That does not generate enough revenue, enough in savings, let's say, to be more specific, to overcome that reduction of $70 million plus another $10 million for a contingency fund. So we had to do what we called is below the line and had conversations across the campus with various policy leaders and others talking about compensation, our pay, and talking about our benefits, right? We like to talk about the University of Kentucky and look at all types of compensation, total compensation. Mm-hmm. So one is that base pay. Another is our benefits program. We have a very rich, very highly competitive 403B. That is our defined contribution retirement plan. In the public sector, a lot of people call that a 401k, which is correct. In the in the public sector, in the private sector, it's called a 401k. In the public sector, it could be called, and for us, it's called a 403B. It's our retirement plan. Right now, an employee puts up 5%, and the university does a 2-to-1 match, and therefore puts up 10. What we're talking about is for 1 year, for fiscal year 21, we're going to have to reduce the employer match from 10% to 5%. So basically we go from a 2-to-1 match to a 1-to-1 match. The goal of that is to do it for just fiscal year 21. And if we get back to safe and normal operations before we think we may, and the sooner we can get back, the hospitals can get open, that we can have our students with us, the campus is not so barren, if you will, then that's the first dollar that we can then put back. Ideally, we'd love to be in a position to not go through the whole fiscal year 21 with this 1-to-1 match and be able to start adding back to it. But our obligation, our fiduciary obligation, our direction that we've made as a leadership team led by our president, President Capilouto, is to be positioned to thrive as we move through and out of this situation. And so we're going to have to do those actions, take those actions to best prepare us to be ready to thrive and to overcome. In some ways, it is an allowance for the unknown. Someone could say, why in the world would you cut more than you need to? Well, we're cutting more than we need to because we don't know our need. I know the need is what it is today, and I've told you it's $70 million. We feel rather confident. It's best available information. That's how we build budgets here at the university. But as we've talked about throughout this discussion today, The unknowns are greater than the knowns. There's risk with state revenues and where those are and how those are generated from businesses. We see a city that has challenges with their revenues because occupational taxes are not producing the revenue they thought. So it's across. Cody talked about how it's changed lives for virtually, who is not impacted by this? It's impacted us all. And so that contingency is an allowance for the unknown. So we're best positioned to move through this and not take additional, I say right side of the equation, wrong side of the equation, right? We want to live on the revenue side, generating more, doing more, serving more. We are. That's what we're going to do. And that's what we're going to work to do every day. But unfortunately, we're going to have to do some actions right now on the wrong side, on the expense side, and some reductions. That's going to harm us. It's going to harm some of our folks. And we have to figure out a way to get through this so we can get back to safe and normal.
You mentioned something earlier I wanted to follow up on. You mentioned we don't do across the board cuts. And I wanted to ask about that in the sense of, do you feel like that provides areas with a little bit more of a stake in the game to be able to take part and make those decisions and feel like this is, we've got a little bit more control over this and maybe we can do a little bit more, maybe we can lobby our case. Is that part of that process?
Yeah, I think so, Cody. And I'll build on that to say, we're not cutting the police department. We're not cutting utilities. We have to keep our buildings open and operational. We're not cutting our scholarship program, right? So we're slowing down the rate of increase because we may have a freshman class a little smaller than we anticipated. But we're not doing that. We're not turning away from our values. We're focused on access and accessibility. Of that $850 million budget, how about this? $150 million of that budget is going back to our students for dollars for aid that they do not have to pay back. That's evidence of what we believe in. That's evidence of our principles. And that's evidence of, to your point, that we are not going to cut every dollar the same percent. We're going to have some differential cuts based on not just opinions, on data and impacts and how best we can position ourselves to thrive once we move through this situation we find ourselves in.
So someone might look at our budget or look at the institution and the dollars flowing around there. Days of cash on hand that we report, or an endowment that's measured with a B for billions, not millions, right? And say, why don't you tap into some of those so that this budget impact is not so bad? How do you explain that or respond to that?
Yeah, and Jay, to continue, you have colleges that have fund balances. Those are savings account for a rainy day. The rainy day is upon us. And so we are going to give those tools, the spendable accounts of the endowment, Jay. So what comes in, you have an endowment Cody gives us $1 million. And then that pays out, let's call it $40,000 a year. And maybe you have $60,000 in that account. You've saved for something that you want to buy, or that faculty member you're recruiting, or that piece of equipment that's going to come upon you. Well, we're going to work with our deans and our leaders that they can use some of what's called non-recurring. Those are one-time accounts. That's a savings account, y'all. That's not a checking account. That's a one-time account. We're going to allow them to use some of that to help solve this problem. The University of Kentucky is not going away. We've been here over 150 years, and the best days for us are still in front of us. But this is a challenge that we find ourselves in. And so we are going to use some of those. We are going to use some of those fund balances. We are going to use some of those endowment earnings accounts. We're not touching the core of the endowment. That's intergenerational wealth that's going to serve this institution for the next 100 years. But yes, the deans will have the ability to use some of those balances, and we didn't scoop them. We didn't cut them. They're out there, and they're in those colleges, in those departments, and that can be a tool. So we could have reduced the cut, right? We could have had a smaller reduction if you went and go, but that's not, Cody, to your point, that's not differential. right? That in some ways is then we just treat people who maybe have saved things better or differently. This way we're going and saying, here's your cut. Here's why your cut is that amount or your reduction. And we want you, and the data sheet the deans are going to get and the departments are going to get, it shows them how much is in their fund balance, how much is in an endowment account that they has spendable earnings and so on. And then we'll work with them to move through these reductions.
How do you think making these reductions now, and as you said, making them even more deeply maybe than we might have to just to meet the line, how do those, or how will those position the institution, as Dr. Capilouto would say, to thrive or grow in the future?
One of the most damaging things we can get in, if we think back to 2008, 09, and 10, and where we were, if we were in higher education or the private sector and so on, is that we need to move. We need to move aggressively, but we need to move beyond that. And so the goal that we're trying to achieve, y'all, and this is not 100% guaranteed, as we've talked about. None of us have been in a situation like this. Cody, I can tell you that on an average hurricane, we're back to normal operations in less than a month. I can tell you, and even Katrina, we were back to normal operations in a couple months. It was but we were back to normal and we were moving. We don't know that. What are we, about a month in on the campus that we have been, quote, shut down, where our employees haven't been with us or been working at home, our students even longer than that? And so we are doing what we think is practical, what is reasonable, what is manageable at this point, so we can move beyond this. We can have these tough conversations. We can implement these reductions. It is going to have impacts we do not like. There's no doubt about it. These are not positive impacts. You don't cut your way to success, and people who believe that is not accurate. Can you be strategic? Can we be differential, to Cody's point? Yes. And are we doing that? Yes. But we're going to be a little more aggressive so we can start getting ready to move out and beyond this when we can go to normal and safe operations.
Well, the other thing that I think about with that too is that for us to get back to that whatever the new normal is very different in some degree, because wherever Kentucky is as a state, we are different in a lot of ways from a lot of places around us, because we are so open to other parts of this country, other parts of this world. Yeah. And so you have this influx. And so it seems like wherever we are, as far as our numbers, and we talk about that whole like flattening the curve and getting our case numbers of people with the coronavirus down, but you're still dealing with other places around who may not have gotten a handle on that. And so it seems like a very delicate kind of dance that we have to do in order to make ourselves open up, but also keep that in mind.
So how we reopen, so we've transitioned, Cody, and the EOC, where our goal was to understand and turn on the academic operations, work with our employees that they started to work with home, to make sure that work was getting done that takes to run a $4.5 billion enterprise, to support our colleagues and friends in UK healthcare that's on the front lines every day, and the 580 or so patients we had in-house this morning, and do those things. Then second was to stand up this field hospital, and that has stood up. It is this is about the fourth field hospital I've been involved in. It's an amazing place, but we hope we don't have to use it, right? We hope that it sits there and is never used. When we started this process, we thought we were going to have a couple thousand COVID patients at peak here on the campus related to our mission. That's started to get smaller based on, to your point, we flattened the curve. It's working. It is working. We are social distancing. We're wearing masks when we go out. We're doing those things. Now, that's great. The challenge, though, is that when you flatten it, it gets longer. And so when it comes back and when we can return, and that is where we are in the EOC now. So we are spending time every day talking about how we return to normal and safe operations. And what does that mean? Does it mean that we gear up at 25 or 50%? Do, the first 13 letters of the alphabet come to work one day and the other 13 another? How are we going to manage that? And how are we going to use best practices? How are we going to have expanded testing? How are we going to be doing tracing? How are we are there opportunities to work with the technology partners we have? It's all of how we're going to do housing. How are we going to do dining? How are we going to do those things to best support not just normal, but normal and safe operations? And if we have to scale differently, I think in some ways it's like an opening a spigot, and we may have to close it a little bit. Not all the way, I hope, but you may have to open it real slow, and maybe it gets too big and then you got to close it tiny bit. So it's going to be this wave challenge is obviously something that is on everyone's mind, and we're going to have to manage through that.
I want to be mindful of your time. You've mentioned a lot of the challenges and a lot of the short-term kind of points of pain and sacrifice that are going to have to come for the institution. But I think you're also probably optimistic about what can happen long-term. Let's end with, talk to us a little bit more optimistically about what you see happening longer term with the budget, with the institution.
So we're willing to do these things that position us to accelerate out of it. Who would have ever imagined that we could turn a couple thousand classes from traditional delivery to online in 8 days? I've been in higher ed over 20 years now. I would have told you you're crazy. I would have said not possible. We did it. Who would have said that we could flip summer and we had 38 days or something like that or more, and it's even going to be more robust because we had a little bit more time? Who would have imagined that we could stand up a field hospital in a couple weeks? So on and on and on. So the 20,000 faculty and staff that we have here, the 30,000 students, over 30,000 that we have here. I mean, we're resourceful. We're innovative. We're looking at ways to accelerate. Look at the research enterprise and how we have responded. We're doing 3D printing the other day for something that was needed in healthcare. How we funneled all of this through the EOC to support this and to communicate both horizontally and vertically throughout the enterprise. We have, and the other thing that is an amazing opportunity for us is we got a great leader. And so we got a leader who's been here for almost 9 years. He has led us through some challenging days and some great days. And there's many more great days. And so you have that team. You got Dr. Newman, you got a provost. We got a good Dr. Cassis. I mean, the research enterprise on Friday, Dr. Cassis stood up a return to normal operations for our research enterprise and to work every day to figure out how best to do that, to scale that up like we've talked about. So I feel the challenge. We all feel the challenge. And we don't want to be doing what we're doing on the budget. We have no choice. Because if we don't make these tough decisions, we will guarantee one thing. We will guarantee mediocrity. And that's not what we're going to be here. That's not who we are. That's not who we've been. And it's not who we're going to be in the future. And so we're going to be more aggressive. We're going to have a contingency for the unknown. And we're going to be positioned as we move through this to strike. And one of the great differentiators we have that I haven't even mentioned is we have one of the best, most world-class healthcare systems in the United States. And so how that positions us as a consolidated enterprise with an academic medical center where we can think differently, we can act differently, we can serve our patients and serve our employees and serve ourselves, that's a differentiator for greatness as well. And so I'm challenged with where we are right now. We're going to have to make decisions that are tough, that are going to impact our people. It's going to impact every one of us. It's going to impact every single one of us when we're talking about our retirement. And it's going to impact where we're going to have to go on, unpaid status, Jay, for some of our employees. We may have to move to a reduction in force or layoffs. And we're having these honest conversations about these things. And if we do, we're going to treat our employees with respect. We're going to respect them in the same way where we may have to adjust that relationship as when we brought them in. and we're going to provide those HR resources. We're going to help counsel them to get a job back with us when we start growing again. But there's no doubt in my mind that our best days are ahead. And we have a team that's committed to that. We have a faculty that's committed to it, a staff, and we have students that need us. We have a Commonwealth that needs us, and we need them. And our obligation, our commitment, is to figure out a way where more students are crossing that stage, not fewer, where we're serving more. The surest way we can be great as a Commonwealth, to have a higher level education attainment for every single person. And that's what we're going to be focused on, and that's what we're going to continue to do. And I can't wait for the day when our students are back and we're walking across this campus and it's thriving again with students and our faculty and staff and the community that we have and that we'll continue to build.
Excellent. Well, thank you again so much for your time. We don't want to take up, we know you have a lot going on. It is really good to kind of put all this together and see it kind of laid out in that sense, and see that we are, despite the challenges, we are being very ambitious with the work ahead of us, and being optimistic about it as well. So, Dr. Eric Monday, thank you so much for being with us. We appreciate it.
Thanks, Sean.
Thank you.
Mm-hmm.